Hey with me, man. Yeah. We're just trying to get up to par. Hey.
Jeffrey Lieberman's recent apologia for the profession of psychiatry shrinks highlights 3 drugs that radically changed the therapeutic landscape, removing it as a profession from the barbarism of the past and placing it on a level playing field with the rest of biomedicine. These were lithium, used in the manic phase of manic depression bipolar, rezapine, the first effective treatment for depression, and chlorpromazine, which appear to offer untold benefits for alleviating the symptoms of schizophrenia. In shrinks, these breakthroughs are like the cowboys of old, triumphing over the Indians and riding off into the sunset to get their gal. In reality, according to David Healy, and extending the metaphor to unjustifiable limits, the cowboys were probably syphilitic drunks who could barely sit on a horse or shoot straight, let alone get a gal. Lieberman, for example, was not big on side effects, and each of these drugs, particularly chlorpromazine, had pretty drastic side effects. Now, anything I say here is a coda to the work of David Healy, whose magisterially detailed creation of psychopharmacology lays it all out on the line. Here, I'm going to focus on chlorpromazine because it speaks clearly to the effects of psychopharmacology, both wanted and unwanted. Following that, I will briefly describe the dopamine thesis of schizophrenia and how that has shaped the understanding of the causes of the disease. I'll leave it in your hands to look up Cade's work and the early story of antidepressants.
Ashing in my shed, got a few 2 liters and it's about to go. Finnegan is the prescription of choice. Just call us the Finnegan boys. I do all this shit just to say get off.
I was surprised when I read Healy's work to find a drug that I still use in my household as a sedative and antihistamine has a close genealogical relationship with chlorpromazine, the first effective treatment for schizophrenia. Phenergan is a cousin to chlorpromazine, otherwise known as Ligactil or Thorazine. And this is how it all happened. Most of you probably don't know about the huge overlap between the dying and pharmaceutical industries, so this story will have its surprises. But there is a very good reason why there should be this relationship. German science by the mid-19th century was celebrated as the best in the world, with laboratories connected with universities and universities connected to local industries. Scientific discovery and technological innovation were close bedfellows. The dyeing industry was therefore intimately connected with the development of chemistry, with companies like Badische Anilin und Soda Fabrik, BASF, leading the way. During the 1870s and 1880s, an organic compound named methylene blue was synthesized and developed by BASF. As a dye, Paul Ehrlich used it in cell staining, which was instrumental in winning him a Nobel Prize. He also thought that methylene blue might be an effective treatment for malaria, and it was used for that purpose as well. Now, it turned out that methylene blue was a derivative of phenothiazine, a discovery that was made in 1885, and initially this compound was used as an insecticide, an anti-helminth, that means anti-worming. And that was that until the early 1940s, when Paul Charpentier at the Rhone-Poulenc labs in Paris began making derivatives of phenothiazine, including promethazine, the active ingredient of Phenergan. What Charpentier had discovered was one of the first really effective antihistamines, and it was marketed for the treatment of allergies and as an anaesthetic stroke sedative. It was at Rhone-Poulenc in the early 1950s that chlorpromazine was first synthesized from a derivative of phenothiazine. Like promethazine, it was thought that it was going to have sedative effects. It turned out that the sedative effects of chlorpromazine outstripped those of promethazine by a long way. So much so that the French military surgeon Henri Labrit, who went on a tour to war-torn Vietnam, which was a French colony, used it as an element of one of his lytic cocktails designed to prevent shock in wounded soldiers undergoing surgery. In combination with ice, it created a form of artificial hibernation that not only sedated but drastically slowed the metabolism. But nobody thought that chlorpromazine would have a use in psychiatry until Pierre Deniker at the Sainte Anne Asylum in Lyon had hunched that using artificial hibernation technique might have beneficial effects in mania and delirium. And this is exactly what it appeared to do, until by accident chlorpromazine was given without the hibernation technique, and the result proved exactly the same. Deniker started experimenting with doses empirically, and soon the hospital fell silent. The noisy psychotic patients had, it appeared, been given chemical lobotomies. As he experimented with his treatment protocols, a number of things came to light. The sedated was still able to react to the normal world when required. Then a long-standing catatonic patient, Philip Berg, who had seemed inaccessible to the world and beyond treatment, slowly came alive and sentient during a course of treatment. Then, here's Healy describing another case, that of the barber of Lyon, who had been hospitalised for several years with chronic psychosis and was unresponsive to his environment. When given chlorpromazine, he awoke from his stupor state and told his doctor, Jean Perrin, that he now knew where he was and who he was, and that he wanted to go home and back to work. Perrin responded by challenging him to give him, Perrin, a shave. The open razor, water and towels were produced, and the patient set about doing his job perfectly. Either Perrin had considerable nerve, or the transformations were truly extraordinary. Deniker and his boss, Jean Delay, hurried the results out, signalling the start of the drug's remarkable rise. For a while, it really did appear to be a miracle cure, which we can see from the way that it was marketed in the USA. When a patient lashes out against them, Thorazine quickly puts an end to his violent outburst. And this remained the case even when it became clear that not all schizophrenics reacted well to the drug. Also, it did have some nasty side effects, like tardive dyskinesia, a condition which affects the extrapyramidal motor nerves and manifests like a form of Parkinsonism, uncontrollable shakes and all that. Notwithstanding the side effects, chlorpromazine marked the real arrival of psychopharmacology, and along with similar drugs was said to have hastened the demise of the asylum. Whether they were really the death knell for asylums is debatable. The populations had already peaked and had started to drop before the major forms of drug treatment were introduced. And while chlorpromazine certainly made lobotomy unnecessary, it didn't have an immediate impact upon the use of ECT. But it certainly alerted the pharmaceutical companies to the potential for making large profits in psychiatric practice.
L-Dopa, fix me, alright?
But just as chlorpromazine and its successors worked, or at least worked phenomenally better than anything previously used, it allowed people to start hypothesizing about why these new antipsychotics succeeded where other therapies had floundered. And this inevitably led people backwards to speculating about what caused schizophrenia. Now, many of the new class of drugs appeared to have dopamine receptor antagonistic effects. Specifically, that if these drugs mediated schizophrenia by blocking the D2 receptor, one of the principal dopamine receptors, then schizophrenia might be caused by the overstimulation of D2. In a logic that had been used before and would be again, the hypothesis was based upon another set of reactions to a different class of drug. It was well known that popping too much speed or snorting too much cane could lead to psychoses. It was also known that one of the psychoactive effects of both drugs was to produce heaps more dopamine in the brain, overstimulating the D2 receptor in the process. So if you put the two things together, antipsychotics, in other words, drugs that prevent psychoses, block the D2 receptor, etc., and amphetamines and cocaine, which produce buckets of dopamine to overstimulate the D2 receptors, thus causing psychosis, you come up with a potential explanation for schizophrenia. But more than that, the somewhat shaky logic of pharmaceutical development is laid bare. Because, of course, as any fool knows, correlation does not equal causation. Now, to be sure, the story is a lot more complex than this, and I urge you to go and do your own digging on this vexed issue. However, when you do, you'll find that the thesis becomes more rather than less speculative. And for all the fact that this theory has been doing the rounds since the late 1960s, it still remains desperately speculative and fundamentally unproven.